Hello, welcome to atomacademytube. This is a medicinal chemistry and pharmacology question with answer and explanation. In the previous section, we'll see some gastrointestinal tract agent having a 15 ml MSQ question with answer, but that are in animated form. But today we'll try to see this question associated with anti-inflammatory drug with a clear explanation and reason outs. So until the end, be with us and please subscribe our channels so as to get an interesting and interactive video in the future consecutive section. So this is anti-inflammatory agent MCQ items with answer and clear explanation for students of pharmacy, and most of the question is highly associated with medicinal chemistry and medicinal chemistry 1 specifically, and the pharmacology. So this question is very comprehensive question which is very important for you guys to understand medicinal chemistry as well as pharmacology and prepare for your exit exam as well. So question number 1 says that the primary action of non-steroidal anti-inflammatory or NSAID drug is A. Antipyretic, B. Analgesic, C. Inhibiting cyclooxygenase, D. All of the above. Yes, as we mentioned, this non-steroidal anti-inflammatory drug inhibits mainly cyclooxygenase, specifically cyclooxygenase 1 and the cyclooxygenase 2, or COX-1 and the COX-2 isoform, so as to give antipyretic, analgesic and anti-inflammatory effect. Therefore, the question says that what is the primary action of this drug? Therefore, A is the answer, B is also the answer, C is also the answer. Therefore, B is the correct answer because all are the effect of anti-inflammatory or what we call non-steroidal anti-inflammatory drug. Question number 2. Which of the following is the common side effect of NSAID drug? A. Hypertension, B. Gastrointestinal bleeding, C. Weight gain, D. Insomnia or sleep disorder. So from this question, as you all know, this NSAID drug, the one that inhibits cyclooxygenase 1, the cyclooxygenase 2, specifically cyclooxygenase 1 drug can be associated with gastrointestinal bleeding. Therefore, B is the correct answer, especially if you take aspirin, which is a class of cyclooxygenase 1 inhibitor, which is the best class of NSAID associated with gastrointestinal bleeding. Question number 3 says that what is the mechanism of action of corticosteroid? A. Inhibits cyclooxygenase, B. Suppress immune response, C. Blocking histamine receptor, D. Increase prostaglandin synthesis. Before that, it is very important to define corticosteroid as a class of steroid hormone which can be produced mainly in adrenal cortex. They used to treat a variety of medical conditions. So as you know, this corticosteroid mainly includes glucocorticosteroid and the mineralocorticosteroid, and their mechanism of action is highly associated with anti-inflammatory effects and metabolic effects, which highly associated with an autoimmune suppression phenomena. Therefore, autoimmune suppression, which means highly linked with B, which is suppress an immune responses. So used for suppression of immune response such as rheumatoid arthritis, lupus, and multiple sclerosis. So this is the correct answer. Question number 4. Which of the following drug is selective for COX-2 inhibitor? Yes, as we mentioned before, COX-1, the COX-2 isoform are there, and there is a class of the drug which can be mainly classified under COX-1 and COX-2. Among the given alternative, aspirin, ibuprofen, celecoxib, and naproxen, the most selective COX-2 inhibitor is celecoxib, and rofecoxib are mainly associated with what? A COX-2 inhibitor. The other one is what is a significant risk associated with long-term use of corticosteroid. A. Liver damage. B. Osteoporosis. C. Kidney failure. D. What we call hyperthyroidism. So as we mentioned before, this one is an steroidal drug which have a response in different medical conditions, and it have a side effect, actually a short-term side effect and long-term side effect are there. In short term, mainly it is used for increasing appetite and mood change, insomnia, and actually sometimes elevation of blood sugar level. In a long-term phenomena, this can lead more serious complications like osteoporosis, weight gain, diabetes mellitus, hypertension, and increased risk of infection. Therefore, among the given alternative, the one which is highly associated with long-term exposure of corticosteroid is osteoporosis. So, to more clarify, this osteoporosis is a condition characterized by the weakening of bone, increasing the risk of fracture, and it is mainly classified under progressive bone disease. Therefore, it is the side effect of long-term corticosteroid. Question number 6. Which of the following is an example of disease-modifying anti-rheumatoid arthritis or DAMARAT? A. Ibuprofen. B. Methotrexate. C. Acetaminophen. D. Prednisone. So among the given alternative, which is highly associated with modifying anti-rheumatoid drug or DAMARAT, is what you call methotrexate. So the answer is what? B. Question number 4. What anti-inflammatory agent is commonly used for the treatment of gut? Yeah, you know that gut is simply the accumulation of uric acid in our blood, also called hyperuricemia. So this is highly anti-inflammatory, or it is an inflammation disease which can be treated by using anti-inflammatory. So among the given alternative, aspirin, allopurinol, indomethacin, diclofenac, the one responsible for the treatment of gut is indomethacin. So indomethacin is a medication prescribed for the treatment of gut. The other one is, what is the primary use of acetaminophen? Acetaminophen can be classified under A. Anti-inflammatory, B. Antipyretic, C. Analgesic, D. Both B and C. So among the given alternative, acetaminophen or paracetamol can be used for the treatment of antipyretic and analgesics. Therefore, the answer is definitely D. Which of the following is not a side effect of niacide? A. Nausea. B. Hepatotoxicity. C. Renal impairment. D. Peptic ulceration. So these niacide drugs have different side effects. Among the side effect of those drugs, one is nausea, the other one is peptic ulceration. So the question says that not typical side effect of niacide. So we have to select from B and C. Renal impairment also another side effect. Therefore, B is the correct answer, which is not the side effects. Which enzyme do niacide primarily inhibit? A. Lipoxygenase. B. Cyclooxygenase. D. What we call phospholipase A2. D. Nitric oxide. As we mentioned before, a niacide drug mainly affect or inhibit cyclooxygenase 1 and the cyclooxygenase 2. Therefore, the answer is cyclooxygenase or COX. So because they are COX inhibitor, so the answer is this one. Question number 12. What is the role of glucocorticosteroid in inflammation? A. Increase inflammation. B. Decrease inflammation. C. Stabilize membrane. D. Enhance pain perception. So as we mentioned before, glucocorticoid and the mineralocorticoid can be classified under corticosteroid, which is steroidal drug, which have a greater medical implication in our body, and this glucocorticoid can be act as an anti-inflammatory agent by acting or decreasing inflammation in simple way. Which of the following is a potential side effect of long-term niacin therapy? A. Edema. B. Hypoglycemia. C. What you call hyperkalemia. D. All of the above. So among the given alternative, which is highly associated with what you call this long-term treatment of niacin therapies, is an edema. So you know that edema is nothing, it is a medical term for swelling caused by excess fluid accumulation in our body tissue. Therefore, this is mainly associated with the long-term exposure or therapy for non-steroidal anti-inflammatory drug. So many times this edema can be associated with swelling, pitting edema, and the discomfort. Especially the swollen area may be painful or uncomfortable. Therefore, it is highly associated with the long-term therapy for niacin. What anti-inflammatory or which anti-inflammatory drug is commonly used for treatment of rheumatoid arthritis? A. Aspirin. B. Methotrexate. C. Acetaminophen or paracetamol. D. Prednisolone. So the one that's mainly used for management of rheumatoid arthritis, which is a best or a class of anti-inflammatory type of drug, disease can be treated by this methotrexate. What is the mechanism of action of allopurinol? So in purine metabolism, you guys can remember this allopurinol. So what is the mechanism of action of allopurinol? A. Inhibit xanthine oxidase. B. Block cyclooxygenase enzyme. C. Increase uric acid excretion. D. Reduce inflammation. So as you know that this allopurinol have a great effect in conversion of uric acid to urate, which can be excreted from our body. So to convert uric acid to urate, which can be excreted from our body, there is a xanthine oxidase which is responsible for this conversion, and this allopurinol mainly inhibits this xanthine oxidase so as to the accumulation of uric acid or hyperuricemia in our blood can be very high, which can be lead us to the disease called GERD. Which of the following condition is treated by corticosteroid? This corticosteroid is mainly used for treatment of actually inflammation as well as another treatments. So osteoarthritis, asthma, GERD, and all of the above. So as you know, this corticosteroid can be mainly used for treatment of what? Asthma, because they have a bronchodilation effect. What is the primary effect of celecoxib? A. Analgesic. B. Antipyretic. C. Anti-inflammatory. D. All of the above. So you know that celecoxib and rofecoxib are cyclooxygenase 2 inhibitor. Therefore, they can be classified under all of the above because they are analgesic, antipyretic, anti-inflammatory. Therefore, this is the correct answer for celecoxib and rofecoxib. Which of the following is a common symptom of inflammation? A, heat. B, a swelling, pain, all of the above. Yeah, this is simple. So all is the answer for this question. Question number 18. Question number 18. The question says that what is the primary purpose of Damarad in rheumatoid arthritis? A, provide immediate pain relief. B, slow disease progression. D, reduce fever. E, D, increase an appetite. So this Damarad mainly used for reducing the progression of rheumatoid arthritis. Therefore, the answer is B, which can be used for reduction of what? The progression. Which can be used for reduction of the progression. So actually this Damarad, which is called disease modifying rheumatoid arthritis, are a class of medication used to treat autoimmune disease, particularly this rheumatoid arthritis and other inflammatory condition, and mainly they act by slowing the progression. Yes, their mechanism of action mainly by modulating what immune response and reducing inflammation, thereby decreasing the risk of joint destruction and improving function. Which of the following is the contraindication of Neoside? Peptic ulcer disease, fever, mild headache, muscle pain. So this the contraindication of non-steroidal anti-inflammatory drug can be associated with another gastrointestinal disorder known as peptic ulcer disease. So A is the correct answer for this question. Question number 20. What is the primary action of leflunomide? A, inhibits cytokine production. B, block COX or cyclooxygenase enzyme. D, suppress lymphocyte proliferation. So this medication or this leflunomide is an immunomodulatory medication primarily used for the treatment of rheumatoid arthritis and other autoimmune condition actually, and the mechanism of action mainly associated or works by inhibiting the proliferation of activated lymphocytes. Therefore mainly this C can be concerned with the answer. Okay, so they suppress lymphocyte proliferation because this is the mechanism of action of this drug. Actually, it is specifically inhibits the dehydrogenase, which is involved in synthesis of pyrimidine. By this way, it can be used for suppress lymphocyte proliferation, and it have different side effects like diarrhea, nausea, and elevated liver enzyme, and their serious side effect may be associated with liver toxicity, bone marrow suppression, and increased the risk of infection. And for pregnant women, it can be avoided because it may cause a teratogenic effect as well. Which of the following is the common use of ibuprofen? A, treating bacterial infection. B, reducing inflammation and pain or analgesic. C, reducing diabetes mellitus. D, lowering cholesterol. So as you know, ibu is classified under anti-inflammatory, therefore reduction of inflammation and pain is the answer. What type of drug is naproxen? A, opioid. B, non-steroidal anti-inflammatory drug. C, corticosteroid. D, acetaminophen. Yeah, this is opioid, non-steroidal anti-inflammatory drug. Can be classified under that. Especially it is COX-1 inhibitor drug. Which of the following anti-inflammatory agent is safe for children? Yeah, mainly anti-inflammatory drug which is very safe for children is acidic ibuprofen rather than the other one. What is the mechanism of action of aspirin in anti-inflammatory therapy? A, it is COX-1 inhibition only, B, COX-2 inhibition only, C, non-selective COX inhibition, D, phospholipase inhibition. So as you know, this aspirin is non-selective cyclooxygenase 1. Even if they can be classified under COX-1 inhibitor, this aspirin is non-selective cyclooxygenase inhibitor. Which laboratory test is often monitored by patient on long-term therapy of niacide? Yeah, liver function test, complete blood count test, renal function test, and lipid panel test. So if somebody have a monitoring, if have a long-term exposure or therapy for niacide drug, the test which can be recommended is simply what, as you know, renal function test, because the long-term exposure or therapy of niacide drug can be associated with kidney infection or kidney disease. So renal function test can be associated with that kidney. Therefore, it is the correct answer here. Question number 26. Which corticosteroid is commonly used to acute asthma exacerbation? A, cortisone, B, prednisolone, D, dexamethasone, C, hydrocortisone. So as you know, this asthma exacerbation are an episode of worsening asthma symptom which can severe and require immediate attention. And this acute worsening of asthma symptom characterized by breathlessness, even wheezing, coughing, and chest tightness are there. Therefore, among the treatments used for this acute asthma exacerbation is the drug known as prednisolone. Prednisone is a drug used for treatment of acute asthma exacerbation. Which of the following is an important consideration when prescribing niacide drug? A, monitoring for gastrointestinal bleeding. B, assessing for liver dysfunction. C, checking for allergies to penicillin. D, evaluation of renal function only. So as you know, this niacide, especially niacide 1, can be associated with gastrointestinal bleeding. Therefore, it is important consideration during the prescription of niacide drug. Which of the following, or what is the role of internuclein in inflammation? So this internuclein is highly associated with promotion of inflammation in our body. Therefore, among the given alternative, the role of internuclein can be manifested in promotion of inflammation. So, reduction of inflammation, stabilize cell membrane, increase blood pressure. So the answer is A. Question number 29. Which of the following anti-inflammatory medication is indicated for acute relief of osteoarthritis? A, methotrexate, B, celecoxib, D, allopurinol, D, azathioprine. So, as you know, this osteoarthritis is a degenerative joint disease characterized by the breakdown of cartilage, actually, and the change in underlying bone. And this arthritis can have maybe a symptom like joint pain, stiffness, swelling, reduced change of motion. And the cause of this osteoarthritis may be associated with lifestyle like obesity, different injury, even genetics can also be the association of the disease, which can be lead acute pain, relief in osteoarthritis. So in mild condition, actually, we also give acetaminophen for such patient, because non-steroidal anti-inflammatory drug for pain relief are there. Among the given alternative, the best anti-inflammatory for this disease is known as celecoxib. Question number 30. What is the mechanism of action of diclofenac? A. Inhibits cyclooxygenase enzyme. B. Block histamine receptor. C. Stabilize mast cell. D. Increase nitric oxide production. So this diclofenac is a class of anti-inflammatory drug which can be associated with what you call COX enzyme inhibitors. So it is cyclooxygenase inhibitor. Question number 31. Which of the following is a major adverse effect of long-term corticosteroid use? Hypocalcemia, high weight loss, Cushing syndrome, hyperthyroidism. So long-term exposure of glucocorticoid and mineralocorticoid, or in general corticoid, can be associated with what you call a Cushing syndrome. Which anti-inflammatory agent is contraindicated in children due to the risk of Reye's syndrome? A. Acetaminophen. B. What you call ibuprofen. C. Aspirin. D. Naproxen. So aspirin is the one that can be associated with contraindication, which leads to the risk of Reye's syndrome. So aspirin, which is non-selective cyclooxygenase inhibitor drug. Question number 33. What is the primary therapeutic use of colchicine? A. Pain relief. B. Anti-inflammatory in gut. C. Antipyretic. D. Muscle relaxant. So as you all know, this colchicine is a medication primarily used to treat gut and other inflammatory conditions, and mainly it can be classified under an alkaloid derived from the Ottoman crocus, what you call Colchicum autumnale, the plant name, and mainly used for reduction of gut. Therefore, B, or anti-inflammatory in gut, is a correct answer. Question number 33. Which anti-inflammatory medication can cause an effect or masking effect on an infection? Acetaminophen, niacin, corticosteroid, and tamarad. So this masking effect can be associated with a corticosteroid, which is a steroidal drug. Question number 35 says that which of the following is a characteristics of systematic lupus erythematosus or SLE treatment? A. Used as an NSAID for pain. B. Used as corticosteroid for inflammation. D. Used tamarad for disease modification. D. All of the above. So before seeing the answer or the alternative, it is very nice to know some concepts about this systemic lupus erythematosus. So this is a complex autoimmune disease actually that can be affected multiple systems in our body, and at a chronic autoimmune condition where an immune response may be mistakenly attack an healthy issue, and maybe it have a fatigue, joint pain, skin rash, and a photosensitivity as well as organ involvement as a symptom. And we can treat such type of disease by using niacin drug, as well as use of corticosteroid for inflammation, and also the tamarad, which can be used for disease modification. Therefore, all are the way of treatment for SLE. Question number 36. What is the function of tumor necrosis factor or TNF inhibitor? A. Promote inflammation. B. Inhibit inflammatory cytokine production. C. Increased pain perception. D. Decreased blood flow. So before seeing the function of tumor necrosis factor, it's very nice to define what are the tumor necrosis factor. So this TNF is a cytokine involved in systemic inflammation and is a part of an immune response. Therefore, mainly it is a protein produced by various cells like macrophage and play a critical role in inflammation and immune regulation. Actually, the most studied types of TNF is TNF alpha and TNF beta. Therefore, whether TNF alpha or TNF beta mainly have a function of what we call inflammatory inhibition of inflammatory cytokine production. So B is the answer. Which of the following is a common side effect of glucocorticosteroid? A. Hyperglycemia. B. Hypotension. C. Bradycardia. D. Weight loss. So this glucocorticosteroid is a class of corticosteroid which is very important in glucose metabolism. Therefore, its side effect may be associated with hyperglycemia. Question number 38. Which anti-inflammatory drug is often used for chronic pain management? A. Acetaminophen. B. Corticosteroid. D. Niacide. C. Niacide. D. All of the above. So as you know, these all drugs can be participate in the treatment of chronic pain management. Therefore, D is the answer. What is the primary role of histamine in inflammation? A. Vasodilation, increased vascular permeability. B. Pain modulation. Fever reduction. Immune suppression. So you know that this histamine have a great role in inflammation by acting as a vasodilator and increasing the vascular permeability. Which of the following is an important monitoring parameter for the patient on methotrexate? A. Liver function test. B. Serum electrolytes. D. Thyroid function test. D. Blood glucose level test. Therefore, in monitoring a parameter for patient methotrexate, you have to test our liver function test as well. Question number 41. Which anti-inflammatory agent is typically used for treating a chronic inflammatory condition like psoriasis? A. Methotrexate. B. Indomethacin, prednisone, and aspirin. So before seeing the correct answer, it is very nice to look at what is psoriasis mean. So psoriasis is, as you know, it is a chronic autoimmune condition that primarily affects our skin, or in short, psoriasis is a skin disorder which can be characterized by rapid skin cell growth leading to thick, sometimes red and scaly patches. Therefore, this type of complication or chronic inflammatory condition can be treated by methotrexate. Question number 42. What is the primary therapeutic indication of ketorolac? A. Chronic pain management. B. Acute prosperative pain. D. C. Anti-inflammatory in rheumatoid arthritis. D. Guts treatment. So as you know, this what you call ketorolac can be used for the treatment of acute post-operative pain, and this post-operative pain may be associated a pain after surgery. Therefore, this ketorolac can be given for acute post-operative pain. Which of the following is a potential adverse effects of high dose of what you call aspirin? Yeah, I hope you all can answer as tinnitus. So this tinnitus is a perception of noise or ringing in the ear when no external sound is present, and maybe it is subjective or objective tinnitus actually, and causes and hair loss, or what you call hearing loss, exposure to loud noise, ear infection, and the different medication, and buzzing, hissing, and the clicking sound in one or both ear can be a symptom for this disease, and this disease can be associated with high dose of an aspirin. Question number 44. What type of drug is anakinra? A. Niacin, B. corticosteroid, C. interleukin 1 receptor antagonist, D. Damarad. So anakinra or anakinra is a medication used primarily to treat autoimmune condition, and mainly use what affects interleukin 1 IL-1 receptor antagonist, and primarily used for rheumatoid arthritis and other inflammatory condition. Therefore, this anakinra is used for interleukin 1 receptor antagonist. Which anti-inflammatory drug is preferred for patients with cardiovascular disease due to the low risk of cardiovascular events? A. Ibuprofen, B. naproxen, C. aspirin, D. celecoxib. So all are anti-inflammatory drugs which can be very important in inflammation, but among the given alternative, the one highly associated with cardiovascular disease due to their low risk of cardiovascular event is known as naproxen. Which of the following is a key symptom of inflammation? A. redness, B. swelling, C. pain, D. all of the above. So all are the symptom. Which or what is the effect of niacin on platelets function? A. increased platelet aggregation, B. decreased platelet aggregation, C. no effect on platelet, D. stimulates platelet production. You know that thromboxane, especially thromboxane A2, which can have a great role in blood coagulation. Therefore, this niacin drug also affects a platelet function by decreasing what you call a platelets aggregation. Which of the following is the major benefit of using selective COX-2 inhibitor? B. reduced the risk of gastrointestinal side effect, B. enhanced analgesic effect, D. increased the risk of cardiovascular event, D. greater anti-inflammatory potency. So you know that cyclooxygenase 1 inhibitor have non-selective behavior and associated with gastrointestinal bleeding as a side effect, and this selective cyclooxygenase 1 is safest for gastrointestinal or GIT or gut. Therefore, their advantage is by reducing the risk of gastrointestinal side effects. So the answer is A. Question number 49. Which anti-inflammatory drug is known for its use in treating ankylosing spondylitis? A. Methotrexate, B. sulfasalazine, C. indomethacin, D. aspirin. So before seeing the answer, it is very nice to know about ankylosing spondylitis. This is actually a type of inflammatory arthritis, primarily affects spine and sacroiliac joint in the pelvis. That's why the name ankylosing spondylitis given. Therefore, this disease can be treated by using an non-steroidal anti-inflammatory drug, biologic as well as corticosteroid, and sometimes we can use regular exercise so as to manage the symptom, and the lifestyle by itself and also the way of treating this disease. But among the given alternative of drug, the one which is very important in the treatment of ankylosing spondylitis is indomethacin. The last question from these chapters: which of the following statement about corticosteroid is true? A. They are non-anti-inflammatory. B. They cause adrenal suppression. C. They have no side effect. D. They are only used for acute condition. So among the given alternative about this corticosteroid, the one which is right or true is the B, which they cause what? Adrenal suppression. A is not correct. B is not correct. Again, C, they only used for acute. This is also not correct. So B is the correct answer. So thank you very much for your nice attention. I hope you get something from my tutorial video. If so, you have to press the bell icon for like and subscribe our channels, and to get all video I post in the future, you have to make the notification on all icon. So in the part 3 we'll meet by another question related to another topic of interest. So until that, have a nice time, and if you have any question, suggestion, please put on the comment section of our channels so as to modify in the future.